One of the exercise inventions that we created for obesity patients is an aerobic exercise using the treadmill. Why do we choose this exercise? One of the main reasons is there are many studies that prove that aerobic exercise like jogging and walking can improve fitness level of a patient. Based on our study on multiple journals, benefits of aerobic exercise include building more lean muscle mass and improve aerobic endurance. This is in par with our aim, which is to improve patients' BMI. This exercise will be done 3 times per week for 12 weeks. The intensity for this exercise is moderate, which is 40% to 50% heart rate max. The time for each exercise is 20 minutes, excluding the resting period. The time will be increased by 1 minute per week as progression. Patient will be free to take 1 minute relaxed walking as resting period. The type of exercise will be endurance training. Patient will be instructed to jog on treadmill with the speed at 40% to 50% heart rate max for 20 minutes per session. If patient cannot compensate, then patient can take 1 minute relaxed walking as resting period anytime patient want. However, in a session, patient must complete 20 minutes of jogging. These are the examples on how patient will perform the exercises. Jogging at moderate intensity, and if patient cannot compensate, patient will walk as resting period for 1 minute, then patient will continue on jogging.
Next is aerobic exercise by using ergometer cycling. The frequency of this exercise is 3 times per week for over 12 weeks. Patient intensity during the exercise is high intensity, which is 90% heart rate peak with 1 minute active recovery intervals. Moreover, patient is instructed to cycle for 10 minutes. The type of this exercise is endurance training. Lastly, this exercise is prescribed as a high-intensity ergometer cycling. This video shows us how ergometer cycling is being done.
Next is stretching exercise. There are several benefits that obesity patients can get from this exercise, such as to maintain the joint range of motion and to increase the flexibility of the muscles. This exercise can be done 3 times per week for a period of 12 weeks. The patient needs to stretch to the point of feeling tightness or slight discomfort. Hold the exercise for 15 seconds, do for 5 repetitions and perform for 2 sets. Examples of stretching that can be done is shoulder stretch, forward bend, hip flexor, quad stretch, and calf stretch.
The purpose of the resistance exercise is to improve the cardiorespiratory, to increase muscle mass and reduce fat mass among the obese patients. This exercise were performed 3 times per week throughout 12 weeks sessions. The intensity of this exercise was set at 60% of the 1 repetition maximum strength according to patient's capability. As for the progression, the load was increased by 5 to 10% every 4 weeks. In one session, patients are required to perform 10 repetitions of the resistance exercise for 3 sets. This exercise mainly targeted 6 areas of muscles, which includes abdominal muscle, chest muscles, shoulder muscles, arm muscles, back muscles, and leg muscles. For shoulder muscle, you can perform shoulder press exercise. For arm muscle, you need to perform bicep curl and tricep extension using dumbbells. While the chest muscle can be strengthened with incline dumbbell exercise. For back muscles, you can perform Superman exercise. To strengthen the abdominal muscle, sit-up exercise can be performed. For leg muscle, you can either perform squatting or lunges exercise.
Go down. Okay, good. Satu.
2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, good.